Tackling pain is an ongoing process, and technology always plays a key role. Let's see how ultrasound is now being utilized in our very first hands-on health workshop.
Today we are showing the participant how ultrasound, which is an imaging modalities, how we use it in the pain intervention. Ultrasound is very good in soft tissue. So traditionally, just spectra a little bit, pain physician either do it blindly, which they don't see anything, or do X-ray, we see bone, but then they don't see a soft tissue. But most of the time, the target is in soft tissue, and ultrasound is the best in seeing the soft tissue. And I would say a lot of those areas that we want to put a needle, we need to see the soft tissue, and ultrasound will guide you there.
Each time I do one of these workshops, I feel like I see more. I'm of the generation of pain physician which I learned with X-ray. Everything was fluoroscopy, which involved radiation. The first time I picked up an ultrasound probe, I thought I was looking at a snowstorm. I couldn't recognize a thing. Each time I come to a seminar like this, I learn a little more, I get a little better. When I go back home, my care of patients is better and it's safer.